Mike, if you are the parent of a young athlete who is dedicated to playing one sport year-round, you're going to want to hear this. Your single sport athlete is 81% more likely to sustain an injury than their peers who play multiple sports.
And making matters even worse, 50 to 75% will suffer a re-injury or experience symptoms later in life. So joining us with important information is Dr. Nick Verma. He's orthopedic surgeon for the Chicago White Sox. He's also the chief of sports medicine at Rush University Medical Center. Doctor, good morning to you.
Hey guys, how are you?
Terrific, thanks. Let's get right into this. We know youth sports is big business. When I was a kid, baseball season, it was, May until whatever, October, but now it's year round. How is that endangering the safety of young athletes?
Yeah, I think you hit the nail on the head when you said that unfortunately youth sports has really turned into business rather than what it was before, which was to just develop all of the skill sets and attributes that help kids to be successful later in life, regardless of whether they're going to play sports. And let's be honest, the vast majority of them are not going to go on and enjoy a professional career in sports, which turns out to be, what they do for their financial well-being. The problem that we see now is that these kids specialize very early, and they spend too much time during the year playing a single sport. So there's a lot of good data out there that suggests that multi-sport athletes have markedly reduced injury risk compared to single sport athletes. And the number seems to be about 7 to 8 months a year of a single sport. If you exceed that level, that's when we see these injury rates going up and up significantly.
Wow. Okay, so let's talk about that. Obviously, it's the repetition that's probably getting to them, but what can parents do to make sure that this doesn't happen to their child? Because as we said earlier, Tommy John was something you saw in the pros, and now here you are doing it in teens.
Yeah, that's the fastest growing segment of athletes who are requiring Tommy John surgery is our youngest age group. As young as 13, 14 can undergo surgery for their elbow based on a sport that they're playing. I think my biggest advice to parents is you've got to be an advocate for your child, right? One of the issues that we see now is that these kids are not just playing on a school team. They're playing on a school team. They're playing on multiple travel teams. They're doing showcases. They're working with private coaches. Really, the two people that are aware of what's going on with the child's athletic performance is the kid and the parent. And they're the ones who have to really look at, is what they're doing reasonable? Is it appropriate? Is it within guidelines that are offered by various organizations such as MLB, such as the American Orthopedic Society for Sports Medicine? The numbers are out there about what are the recommended pitch volumes, the rest time, as well as the number of months per year. And it's really the job of the athlete and the parent to make sure that they're adhering to those guidelines to reduce the risk of injury as much as possible.
Hey, Doc, you and I were kids once, and we felt like, we were impervious to just about anything. What do you want parents to know about symptoms? We know with Tommy John, it's a tendon, right, in the elbow, and then you use the wrist tendon and you replace it. But can you catch this in advance? And are parents, in your mind, are they being proactive enough when it comes to talking to the young athletes about what might be wrong?
Yeah, so the Tommy John is a ligament that connects the top bone in your arm to the bottom bone in your arm. And really, it's an almost exclusive injury to throwing athletes. We see it a little bit in gymnasts, very rarely as a result of trauma, but the vast majority of these procedures that get done are in the throwing athlete. And it's simply because that ligament is being asked to operate right around its failure load. So every time you throw a baseball, you're right in the zone where the ligament may fail, which is why, current MLB statistics would suggest that about a third of our players are undergoing Tommy John at some point. The second problem that we know is that these athletes do experience pain during throwing. We did a study where we took a survey of athletes that were either children or adolescents, and more than a third of them would say that they routinely experience pain with throwing. I think the two biggest keys are, number one, is these athletes know their body, especially when they've been playing the sport for long enough. They know what's normal soreness and they know what's pain soreness. When they have pain soreness, you need to stop and ask the question, what's going on? And at the very least, take a rest period until that soreness resolves. And then again, we know what the risk factors are for kids developing these injuries. And it's primarily, number one, far and away, overuse. And so it's about being proactive in managing the amount of throwing that's actually going on to try to reduce the risk as much as possible for your child.
Yeah, keep your eye on your kid. That's a tough thing. Sometimes it can be easier said than done, and I could see a situation where maybe a child does not want to admit that they're suffering and dealing with any pain. Dr. Nick Verma with Rush University Orthopedics, thank you so much for joining us this morning. Appreciate your time.
Me.